My name is Scott Smith. I am from Winston-Salem, North Carolina, and now I live here in Rochester, New York. I work at the University of Rochester Medical Center as an assistant professor for the Department of Public Health and Science. I do research focusing on deaf youth and how to improve their health knowledge and their health literacy. I went to the East Carolina University. That's where I did my main biochemistry work, and then I worked at the medical school there. The name of it is the Brody School of Medicine at East Carolina University. I graduated and got my medical degree there. When I applied to medical school, I applied to 15 of them, and I was offered 3 interviews. 2 of them were not very familiar with deaf people at that time. This was 1992, so that was way back. There weren't a lot of deaf or hard of hearing doctors at that time, so they weren't very familiar with how to provide interpreters. But I was fortunate because I went to a college that already had some experience with interpreters. That college had a deaf and hard of hearing program there. So when I applied to medical school, it was at the same place, it was at the same university. We were able to figure out how to match my needs. So they offered me the opportunity, the door opened, and I was able to get my foot in. And the rest, they say, is history. I work at the Rochester General Hospital, RGH. I've worked there for 4.5 years, and I've seen many patients. Mostly, they're families with hearing people, but also I would have an interpreter with me all the time. It's a challenge with the hospital, but I was able to convince them that it was worth their investment to pay for an interpreter for me so that I have the opportunity to work with the families and their children. They seem to really appreciate that because being deaf sometimes gives me an advantage. I'm able to look at people's body language. That gives me the opportunity to communicate with children better than maybe their parents. Their parents sometimes say that their kids really love to come and see me because they think that being deaf is cool and that sign language is cool and that it's very visual. And I can use that to my advantage to talk with them. And they don't mind coming back to see me, which really surprises their parents because normally children do not want to go see a doctor. But they don't mind it. They enjoy coming to see me. So there's a lot of positive feedback that I was able to use to convince the hospital that it is worth their investment to pay for an interpreter for me. A lot of them don't know their family history. It's the kind of information that deaf people don't always pick up. Hearing children might hear their family discussing and talking about, oh, their grandmother who has a heart problem, a heart attack, or might be taking a certain medication. But deaf people don't overhear that type of information, and they miss out a lot on the family history. And there are a lot of words that, like cholesterol, that type of word, hearing people overhear that on television, on advertisements, and they might not understand exactly what that word means. but they're aware of it. They know it's a bad thing. But deaf people might misunderstand. They might think that cholesterol is something that's good for them, something that they add to their food to make it taste better. Because the information is presented to deaf people that might lead them to a significant misunderstanding. And that can affect their health and their health problems. Unfortunately, deaf people seem to have a little bit more problems with their heart than hearing people. We did a survey at the National Center of Deaf Health Research, which showed that deaf people have more vascular problems than hearing people. And I think that we believe that part of the problem is related to their health knowledge. Plus, some of their access to communication, not being able to get all of the information that they need. They need that to make better decisions for themselves. One of the reasons that I transferred was because it would give a more impact on the deaf community. I love the clinical work. I love working one-on-one with patients. And so I wanted to increase the number of deaf people, and I also enjoy the research as well. It's a different way of thinking. How to help those deaf people understand more about health. And I think that that's very important for the future, because if you have health insurance and if you change the healthcare system, the expectation is that people would have more knowledge, more awareness of their health and their health needs. It means that they can be more independent. A lot of deaf people are sometimes behind on that information. So I see that this is a significant bridge to fill that gap. When I talk to deaf people who are interested in healthcare, I always encourage them to first be confident. You have to be very confident in yourself, because you will be interacting with a lot of hearing people who may not know a lot about deaf people. So sometimes you have to teach them about what it's like to be deaf. And so you definitely need to be confident and not nervous. They will see right through that. Plus, you have to communicate clearly, which means writing or typing out emails, and you need to have good English skills. And you have to use an interpreter to make sure that you have a good interpreter as a team, because it's very important for the interpreter to be able to present you very well. You have to be able to sell yourself to the hearing world, and sometimes that's very difficult too. You have to make good grades. It doesn't matter whether you're deaf or hearing. Anyone who gets into the healthcare field needs to make good grades. You have to prove that you are capable of doing that type of job. It's very important to be optimistic. You have to be very confident. You have to go ahead and give it your best try. I love working with people. I really enjoy making people feel better. I see it in their eyes, and that feeling makes me feel good about myself too. That's who I am. That's the way I was raised. So I enjoy making other people feel good. I think the most important thing is deaf people don't let anyone tell them that they can't do something because they want to do it. You really have to be motivated and figure out what way you can make something happen, because it might not be a normal route. You might have to take a wandering path or get around blockades. You have to be creative, and you have to find hearing people who are open-minded. They will be able to help you and be willing to work with you. If someone says no, don't just give up. You must be persistent and somewhat stubborn.